So first, what are brown spots? Brown spots, sometimes called age spots, liver spots, or solar spots, are areas where your skin produces too much melanin, the pigment that gives skin its color. Melanin is like your skin's natural sunscreen. It protects deeper layers from ultraviolet light. But when your skin gets repeated sun exposure over the years, those pigment producing cells, melanocytes, start working overtime and clump together. The result? Flat, tan to dark brown patches, usually on the face, chest, shoulders, arms, and hands. And these spots are not dangerous by themselves, but they tell a story of about your skin sun exposure and inflammation. So why do brown spots happen? That's the next question, and that's the favorite question of my patients. And there are three main reasons. The brown spots develop for several reasons, and understanding which one applies to you actually helps choose the right treatment. So, number one is sun damage, and this by far is the most common cause. Brown spots are really your skin's way of remembering every bit of sunlight it's ever seen. So, decades of daily exposure, even from driving, walking the dog, or sitting by a window, add up over time. And as I noted earlier, UV light stimulates pigment producing cells called melanocytes to make more melanin for protection. But after years of repetition, these cells begin to overproduce and clump together, forming these visible brown patches. And it's almost like your skin has a sun memory, and those dark spots are its photo album of past exposure. So the next cause of brown spots is hormonal. Hormonal changes can trigger brown spots, especially in women, of course, during pregnancy or with birth control pills. Estrogen and progesterone can stimulate the pigment cells, leading to a condition called melasma. So, those larger, patchy brown areas, often seen on the side of the cheeks, forehead, and upper lip. Melasma tends to get darker with sun exposure, heat, and inflammation. And that's why even something as simple cooking over a hot stove or taking a warm yoga class can make it flare up. It's not dangerous, but it can be very persistent, and managing it usually means protecting the skin year round, not just in the summer.